Hello, my name is Alicia Miller. I am currently a doctoral student in the area of psychology. Today's presentation is part of my dissertation focusing on Smith-Magenis syndrome. We will be discussing the most critical attributes of SMS, followed by academic and behavioral strategies for the classroom. I am aware that many viewers may not have experience with SMS, nor may have you ever had the opportunity to work with an individual with SMS, but my hope today is to generate some awareness of this syndrome, as well as provide classroom strategies that may be used for students experiencing similar difficulties even without SMS. Most individuals with SMS have a comorbid diagnosis of autism spectrum disorder and also sensory processing disorder and/or intellectual disabilities. Therefore, many of the strategies we discuss today will be pertinent for others. Let's first begin by discussing what is Smith-Magenis syndrome. Smith-Magenis syndrome is caused by a small microdeletion of a portion of their 17th pair of chromosomes. There's a specific piece, the 17p11.2, which typically causes the child to develop features of SMS. Currently, this syndrome is very rare, where there's only 900 people in the world currently diagnosed with SMS. Interestingly enough, 4 of those individuals live in the state of Arizona. Next, let's talk about some characteristics of SMS. There are pictures on the left-hand side of your slide, 6 individuals total. Each of these individuals have been diagnosed with Smith-Magenis syndrome. So if you look at these pictures, you will notice flattened midface, downturned mouths, and also tinted upper lips, prominent and often rosy cheeks, prominent jaw in older children and adults, and then they also have dark eyebrows that tend to meet in the middle. They have low muscle tone. Many times in early childhood, they do receive early intervention services for physical therapy just to help increase this muscle tone. Oral sensory motor dysfunction. Really, the poor suck and swallow typically is the biggest concern in early infancy, and they do receive feeding therapy typically for this. They can also have decreased tongue strength and movement, open mouth posturing, frequent drooling, and textural aversions. Sometimes they also receive speech and language therapy throughout their early childhood into their school age speech and language therapies to help assist with some of this. They're known to have middle ear problems. Many times they do have chronic ear infections, and then laryngeal anomalies. This would be something like tracheomalacia early on, where they have a floppy airway, or there's multiple other anomalies that can occur. They do have a hoarse voice and sometimes hypernasal speech, short fingers and toes, hyporeflexia, some signs of peripheral neuropathy. So this is interesting, and I would like to see some more research done in this area, because many of the children are diagnosed with a sensory integration disorder. So now whether or not this is the same thing or 2 different things happening, it would be really interesting to hear some more professionals look into this. They do also have flat feet, distinct broad-based gait, and also decreased sensitivity to pain, which is very interesting in children and adults with SMS. Many times it is noted that they do not feel pain, or they don't seem to feel pain at all. So that's something that you'll probably hear about these individuals. Individuals with Smith-Magenis syndrome are typically diagnosed with a developmental delay early in life. This diagnosis typically results in early intervention services consisting of speech and language therapy, occupational therapy, and sometimes physical therapy. Now, as further evaluation is completed, variable levels of intellectual disability are diagnosed. These intellectual disabilities typically range from mild to moderate in severity. When these children are infants, they're noted to be lethargic and complacent. Typically, this is due to Smith-Magenis syndrome in general, but also just note that there are a lot of comorbid medical diagnoses that go alongside Smith-Magenis syndrome. Many of these children are diagnosed with congenital heart defects, which certainly you will see lethargic behavior with congenital heart defects. There's also a lot of other diagnoses such as kidney reflux, scoliosis, things like that. So just something to be aware of. In addition, another interesting behavior that is noted is mouthing objects or hands beyond that typical stage in early childhood. So we know that this is something that's common in young children, but this is something that typically continues past that age. They will put their entire fist in their mouth sometimes. A lot of children are noted to put 2 or 3 fingers in their mouth, but you will see a lot of hands and objects going in their mouth. There's also speech delay and articulation problems noted, which we've discussed, as well as sensory integration issues. Most children do grind their teeth. That actually continues also into adulthood. They're delayed in toileting skills, so not just potty training, but also continued nighttime bedwetting, sometimes into the teen years. And then there's also noted maladaptive behaviors. Now, this is probably the most notable characteristic within Smith-Magenis syndrome. They are known to be hyperactive, impulsive. They do seek attention, which we'll talk about a little bit later as well, specifically from adults. They are easily excited and distracted, suffer from frequent mood swings and mood shifts. They do have explosive outbursts, prolonged tantrums, and aggressive and sometimes very destructive behavior. Another notable characteristic of SMS is the inverted circadian rhythm. So they do have quite an extensive sleep disturbance, which we will discuss a little bit later. They're also very stereotypic and repetitive in certain behaviors, such as arm hugging and hand squeezing, which is, this is something that they're doing to themselves. They're hugging their own arms and squeezing their own hands. They can also display quite self-injurious behaviors, which again we will talk about in just a little bit. So these were all problematic type behaviors that occur frequently with individuals with Smith-Magenis syndrome, but I also think it's important to talk about the positive behavior features, because they truly have the most endearing and appealing personalities. They are very sweet and loving and caring individuals. They also have incredible long-term memory for names, places, and events. There have been stories out there where parents have shared that their child can remember their therapist's phone number from when they were like 3 years old and they're now 12. They can just remember every person that they've ever met. They remember faces and names, just incredible, impeccable memories. They also have a great sense of humor. They are typically very happy individuals, and they want to please and they want to make others laugh. They're great people to know. Self-injurious behaviors are common among individuals with Smith-Magenis syndrome. Up to 90% of diagnosed individuals will participate in some sort of self-injurious behavior. What this typically consists of is self-hitting within about 71% of individuals. About 77% of individuals have participated in self-biting. 65% participate in skin picking. 25 to 30% of individuals will remove toe and fingernails, and also 25 to 30% of individuals will insert foreign objects into body orifices. So if you'll look at the pictures on the right, the boy in the middle here is participating in hand biting behavior. So you'll see that his hand is in his mouth and he's biting pretty hard down on it. Now the picture on the right is the aftermath of such behaviors. Typically what happens is this becomes a repetitive behavior. Once they get escalated and start to have a meltdown, it just becomes habit where that hand goes straight to their mouth and they start to bite. and re-engage and re-injure that particular area. So a lot of times if it has been scabbed over, they're going to pull that right back off, and that area is really never allowed to heal. So it can really result in some extensive damage to themselves. It's definitely something that individuals who work with children with SMS need to be aware of, because it's more than likely going to happen. Some research does show that there is some association with self-injury and the decrease in adult attention that the child is receiving at the time, as well as an increase in some sort of task demand. So again, something to pay attention to and to be aware of when you're working with children with SMS. A common behavior with individuals with SMS is the meltdown. The meltdowns can come on fairly quickly and sometimes for unknown reasons. We'll talk about some of the known antecedents to this behavior later on in the presentation. When you see a meltdown, typically what you will see is the student or the child may fall to the floor. They tend to whine, cry, and sometimes scream. This may be when you would see self-harm behavior. They'll do the hand and the wrist biting, sometimes head banging, face slapping, and scratching at their skin. They can also become very aggressive towards objects and others during this time. This is when you may see items being broken or ripped, and they have a tendency to punch and kick at others or objects. Individuals with SMS are known to have a high threshold for pain, so this may lead to an increase in the amount of self-harm or aggression that is presented during this time. This is typically the behavior that's targeted for behavior intervention strategies, as it can be very extreme. Sleep disturbance is highly common in individuals with Smith-Magenis syndrome. Their sleep disturbance consists of frequent nighttime awakenings, increased daytime sleepiness and naps, and early morning wake times, typically between 5:30 and 6:30. So not only are they awake at night, but typically they are up, and there are many stories of children getting into things that they're not supposed to in the middle of the night. So most families have to have their refrigerators and their pantries locked, because children will get into the kitchen and eat a lot of food. They will also sometimes get into things such as the bathrooms, where they have caused floods or clogged up toilets, multiple different shenanigans that they can get into in the middle of the night. So there's a lot of strategies that need to be put in place in the home for safety of these individuals. They also have increased daytime sleepiness and naps. So as you can see in the pictures, each of these children have fallen asleep in some interesting places and positions. But basically, you know, when sleepiness hits them, they just are out. They'll fall asleep pretty much anywhere at any time. And then the early morning wake times are typically between 5:30 and 6:30, but there are a lot of stories of children that wake up even earlier than that frequently, and then they're up for the day, which typically then can lead to some more of those meltdowns and the maladaptive behaviors that we have discussed earlier in this training. So for teachers, it's highly important to understand their sleep schedules, because sleeping in school is very common. They will fall asleep during centers like this, or, I mean, there's been stories of children falling asleep in the middle of PE like this. So naps sometimes are just necessary to get through the school day. Sometimes just a 20-minute little power nap will reset a child to be able to finish out the school day with little to no meltdowns and more participation. The most commonly identified processing deficit within individuals with SMS is a deficit in sequential processing. So sequential processing is processing that occurs in the order that it's received. This would include concepts such as first, next, and last, today, tomorrow, next week, and then, of course, building upon previously learned information may be difficult if ordering is pertinent to understanding. If they really need to understand that a certain concept must come first, then something else comes next. I'm thinking an example would be something like order of operations. If they really have to understand parentheses comes, what you do in the parentheses comes first, that's going to be something that's going to be very difficult for them, if not impossible, to complete without some sort of visual cue and a lot of accommodation for that particular concept. So that might be more of an advanced concept, but I'm sure teachers out there can identify some other areas where sequential processing is very important at more elementary type concepts. So a pretty easy accommodation that can be put in place for these students is a chart such as first then. It's a simple visual cue. The chart consists of the word first at the top and then on the right. So you'll see the first picture here on the first then chart on the left is the one that I'm describing. So first they are required to do a task. Then they are going to do something else. So this kind of just helps to put them, to get them to understand that there's a sequence involved here. So typically how this is used is first they're going to complete a task. A lot of times this is more of a non-preferred task. Then they get a reward or a preferred task of some sort. So they'll see that they're working for something. So that's more of an elementary way to use a first then chart. Sometimes as children advance and they don't have as much difficulty staying on task and completing those non-preferred tasks, sometimes this just becomes first you're going to do this task, then you're going to do this task. As long as they're able to complete that without a lot of behavioral intervention, then that's absolutely appropriate. The second chart here, the first, next, then, last, is a little bit more advanced. So this would be probably for higher elementary, middle school children with Smith-Magenis syndrome. This basically just lists what it is that it's like a modified to-do list. So first they're going to do this first activity, next this, then this, and lastly they're going to do this. So this is something that just kind of schedules a short period of time for them, which is really important. They're constantly curious about what's next, what are we going to do, and what does my day look like. So this kind of just helps to put that out there so that teachers can refer back to their visual cues and not have to verbally answer every time they ask what's next. You will thank me later for this one. Okay, here are some accommodations to help support that deficit in sequential processing. So first, let's talk about writing. Developing templates for repetitive procedures for paper writing is a great accommodation for teachers to use. This helps to keep their expectations clear. So if a teacher expects a student to have their name at the top of the paper and a date underneath that, then this is something that they can provide a visual model to show exactly what it is their paper needs to have on it before they start writing. And then once they start writing, what kind of spacing and indentation do they need? Whatever it is that they're working on at the time that's grade level appropriate should be shown in a visual map or like a visual model for them. So that way they will be able to refer to that and they can look at their paper and then the visual model to make sure that it looks the same. Also the use of visual maps for brainstorming and organizing. This is really helpful for children to stay on topic. So not that this is an issue that's really specific to children with Smith-Magenis syndrome. Really, any child early on who's learning how to read has a tendency to get off topic when they're writing. So by offering a visual map, they're able to really put down specifics. What am I going to talk about first? What am I going to talk about next? What's important to talk about in the end? How do I need to wrap this paper up? So by offering this visual map so they can put some notes down, that would help to organize what it is that they're trying to get at and make sure that they stay on topic. In math, developing guides and visuals to assist can also assist in setting up visual tasks or sequential tasks. So one of the really easy accommodations that you can use is just use the use of a highlighter. you can highlight things like boxes. So if there's empty boxes, you can highlight the fact that there's 2 boxes there, meaning that there should be 2 numbers. It's a 2-digit number that you're working with at the time. This would just give them a visual cue so that they know the size of the number that they're supposed to be working with. They can also incorporate things such as color coding. You know, if you have in your classroom, pink is always the first step, purple is always the second step, blue is always the third step. This is something that would really help to assist them in that sequential piece so they know first, next, last for math steps. Also the use of mnemonic devices whenever possible to assist with remembering steps in order. Things such as PEMDAS, please excuse my dear Aunt Sally, helps with the order of operations. Or never eat soggy waffles helps to remember directions, north, east, south, and west. But those are triggers that would help them to remember those things. Remember, their memory is typically something that's very advanced and something that's really a strength for them. So anytime we can tap into that memory, the better off they'll be with that particular concept. And finally, reading, very similar to the other subjects we were just talking about. Don't assume that they're understanding the sequence of the story. So it's very important to understand the sequence of the story so that you really can comprehend what happened. Sometimes that doesn't happen, and a lot of times the story is then not retained because they really didn't understand the sequence, therefore they didn't understand what they read. But if you offer them something such as a story map so that they can take notes while they're reading, if it's a read aloud story, they could either, if they're at the word level, they can write some words to trigger the memory for what happened first. They can also just draw pictures if they're not quite at the word level yet. If they're at the sentence level, then great, they can write a full sentence that just describes what happened in the beginning of the story, in the middle, and the end. So something just to note about all of the accommodations we just discussed, each of these are going to need some explicit instruction in how to use them. So just make sure when you're using these that you are also setting aside some time to teach the student how to utilize these accommodations and strategies and what your classroom expectations are for these pieces. So if you have a physical story map or a some sort of a model that you've done and maybe you've laminated it and you want them to keep it in their desk, where is it that it should be when it's not in use? Where do you want it to go? What is the cue for when can they take that out? Is there anything that you've put in place to give them those cues? Just make sure that the expectations are there. Sometimes these tools can become toys, or they get lost or damaged, or aren't taken out at the right time. So it's just going to be really important to make sure they understand when it is that they can use them and how they're supposed to be used. Executive functioning is another common area of deficit in those with Smith-Magenis syndrome. Executive functioning occurs within the frontal lobes of the brain, and this is really the CEO of your brain. So this allows for planning and implementation of complex tasks to happen. Executive functioning includes mental control and self-regulation, which we know are areas of need for children with Smith-Magenis syndrome. There's also further cognitive components of executive functioning are attention control, cognitive flexibility, planning, goal setting, inhibition, and self-monitoring. All areas that we know individuals with Smith-Magenis syndrome really have difficulty maintaining, especially when doing non-preferred tasks. Okay, sounds like we are in need of some good strategies for executive functioning. So let's start with providing a structured organizer for breaking projects into smaller parts. This is going to be really important to get the children engaged in the task even to start. If the task looks too big or too cumbersome for them, you will see shutdown behavior, and more than likely you'll start to see some meltdowns. So it's going to be very important to break down those projects into smaller parts and make sure that they understand that if they know that it's a bigger project, make sure they understand that it's only a small part that's going to happen first. A lot of times teachers don't even really introduce the bigger project yet. They just do the smaller parts and then add them on together to start building that bigger project, so this child does not get overwhelmed. Use of a timer to encourage students to complete an activity within an allotted amount of time is also highly beneficial. Again, the student's going to need to be trained on how to use the timer, and then sometimes they can begin to perseverate on the timer and only play with the timer and not really do that task. So there is going to have to be some adult intervention there to teach them how to appropriately use the timer. Sometimes the timer can't be on the child's desk. Sometimes it needs to be maybe a visual timer at the front of the room or on an overhead, or something that they can't play with. Sometimes so that it doesn't just become a distraction for them. But it is important for them to know that there is a time allotted, and it kind of helps to keep them focused. Plan the student schedule so that activities requiring the most focused concentration are during periods of the day that the child is most focused. So typically students with SMS are better off early in the morning because they've already been up for a while. So a lot of times first thing in the day it's probably best to try to get most of that more difficult activity done then. And then as the day progresses, they start to get more and more tired, then maybe have lesser expectation for concentration during that time. Provide quiet locations for the student to work. Again, they can get highly distracted, especially by adults coming in and out of the room. They're kind of like the constant greeter of new faces in the room. So if you really need them to focus and get something done, it's going to be really important for them to have a quiet location where they know that they can't necessarily see the door, or they can't get very distracted. Attention cues are always good to use within the classroom so that the teacher can quietly cue the child to get back to work without having to stop what they do. So whether they have a special cue between just the teacher and the child, or even just eye contact, or just a point back to the desk, sometimes that's all that's necessary. As we get into behavior later on, you'll know that reducing the amount of adult attention is going to be most important. So if you can identify an attentional cue to cue that child to get back to work without providing them too much adult attention, you'll have a lot more success. Use an incentive system to encourage the student to remain on task. So a lot of times they are motivated by stickers or snacks or something, whatever it is that the child is motivated by. Try to make sure that there is a consistent incentive system. They know that it's coming. They know that they have the ability to get that. If it's not consistent, they're not going to buy into it. So you need to make sure that it's something that they know if they complete this, then they get this. So this leads us to the next one, that if-then plan, to encourage them to remain on task. So if they complete this task, then they get some sort of a reward or a free time or a preferred test, such as Play-Doh or computer or something like that. Next, teach the student to use accommodations independently. So again, these children tend to be highly motivated by adult attention. So it's going to be very hard to teach them independence. So it's going to be something that early on in the school year, it's going to be important for the teachers to establish that there are times where independence is expected. So teaching them to use some of these strategies so that they can be independent is going to be highly, highly important. So, even back to that timer, if you're only expecting them to be independent for 2 minutes without getting up, make sure that that expectation is there. Make sure that they know as soon as that 2 minutes is up, they can get up and they get some sort of a reward for staying within their seat and working on their task for those 2 minutes. Self-monitoring checklists would be something that, as the child grows and is a little bit older, it's going to be important for them to be able to monitor their own behavior. When they're very young, their brain's not quite there yet. They're not quite ready to self-monitor. But as they grow, it's certainly something that we're going to want to work towards so that they can gain more independence and hopefully more life skills as they grow. And then direct instruction of organizational strategies and attentional strategies. Again, we're trying to build independence in these students, so they're going to need direct instruction and understanding as to how to use these themselves without having to rely so much on the adult to provide that for them. Okay. Visual supports are an important strategy to support any sort of executive dysfunction. If we start looking at the daily schedule on the left, this is a great example of just a small period of the day for a child. So basically what this does is it allows them to see what is happening for a small chunk. A lot of times teachers like to just put the morning schedule, so maybe up until lunchtime, out on their desk so they know exactly what they're going to do between first thing in the morning and lunchtime, and then they'll switch the schedule out for after lunch so that the child is aware of what's going on after lunch. And it really just breaks down each piece of the day so that they know when they're going to be able to have a break, what they're going to do next. Students with SMS typically have some anxiety, and they just really need their day lined out so that they know the expectations and what they can plan for throughout the day. They also tend to perseverate on certain periods or activities throughout the day. So for example, if they really like PE, a lot of times they're going to ask when's PE multiple times throughout the day. So that's something else that could be worked into a schedule, so the teacher can just point and show them this is when PE is, but we're going to do this, this, and this next before PE. On the right hand side, this is an example of a picture that's made using the Sketch app, which is a free app that you can upload pictures, personal pictures, and then write on them. So I know there's multiple apps out there that are available, but this is just one that I found that seemed to be really easy to use. So basically what you're able to do is upload a real picture, and then all of the circles and the writing on the picture were made within the app. So you can just label things that you want to point out. So this really gives the teacher an opportunity to highlight what that child needs to be focused on. So for this particular picture, this is a beginning of the day routine before the child gets on the bus. So she needs to be reminded multiple times verbally what it is that she needs before she can leave to get on the bus. So instead of having to do those verbal prompts, we were able to put a picture up and label all of the different objects and materials that she needs to be ready. So she needs to have her uniform on, a cup, her shoes, her lunch, and her backpack. So instead of those constant verbal prompts in the morning, the parents can just say, go look at your picture and make sure you have everything, and she can match that up. That can easily generalize over into a school environment. So when a child needs to be ready to work, you can, as a teacher, you can take a picture of that child when they're sitting at their desk and they're ready to work. What is it that you would like to highlight? Do you need to, do you want to make sure that the child has a pencil in their hand, specific materials out for that particular period? Are we working on sitting in your seat? So all those things that you would like to highlight, you can certainly circle. Look, this is a picture of you in your seat with your pencil. That means you're ready to work. So they can just model that picture throughout the day without having to require so many verbal prompts, which really helps to get through the day a little bit easier. And then the picture on the far right is a ready for school board. These are things that you can do in the classroom as well. Ready for lunch, and you can put pictures up that this is what you look like when you're ready for lunch. You're standing in line in a certain way, you have your lunch box ready, but all things that are just really easy to take a quick snapshot and just gives the child a visual reminder of what it is that they need and what they should be looking like. Okay, let's move on to behavior. So individuals with Smith-Magenis syndrome commonly display attention-seeking behavior, aggressive behavior, and self-injurious behaviors in the classroom environment. So obviously these behaviors can be highly disruptive in any classroom setting, wherever it is that they may be placed. Typically, students with SMS are in either a self-contained setting for students with special needs or a private day school setting specific to those with special needs. They do typically have some sort of an individualized behavior management program. Most of the time there's been a functional behavior assessment completed, and that functional behavior assessment has identified attention seeking as the function of that behavior. And then the behavior intervention program is designed to help with that attention seeking behavior. So what's interesting is children with SMS deal with adult attention a little bit differently, and you can't typically use the common ways of intervening with attention-seeking behavior with children with SMS. So they are very adult-oriented. They demand an inordinate amount of individualized attention from adults. When this is denied, the aggressive and self-injurious behavior is the result. So they're not having that behavior to gain the attention. They're having that behavior because they didn't get the attention, which is very different. So really what these behaviors are, what these students are telling us is they require, to get through a school day, they require an adult. So because this attention is so highly necessary, and because it sucks all of the attention really from the other kids in the class, typically these children are given a one-on-one aid or a paraprofessional. So that way there is an individual there that is designated to them to give them the attention that they require throughout the day. It's really important for these kids to have somebody that they bond with, that they can go to, and they can trust. Their anxieties typically lower when they have somebody that they know gets them and they know can have their needs met. So when their anxiety is lower, their behaviors are typically lowered as well. They then require that when they require that adult attention, that person is there, that person knows how to read their cues, and hopefully can stop that behavior from becoming a full meltdown before it actually happens. A calm, consistent, non-emotional classroom environment is highly important for those with Smith-Magenis syndrome. Non-emotional tones should be used as much as possible throughout the school day, because our children with SMS feed into that tone. They feed into the emotion behind the tone. So if they feel that you are angry, or if you're getting frustrated and louder with them, they sense that, and then typically that is going to set off behaviors. So the more teachers can maintain just a non-emotional flat tone with them, the better off the child will be, and they won't be pulling in quite as much emotion and won't be reading too much into that emotion. Children with SMS also do best when there's really small classroom sizes, so about 5 to 7 other children in a classroom with a minimum of one teacher and one teacher's aide. Again, a one-on-one aid is best for these students, but reality is that doesn't always happen. But the teacher is certainly going to need at least an aide in there, because one teacher is not going to be able to handle a child with SMS and any other students in the class. With the class size above the ratio, the competition for that attention also becomes greater for the child, and then that child likely displays more behaviors because there's more competition for adult attention. And then also on that thought, consider other classmates in the classroom are perceived by that child with SMS as competition for attention. So though they are typically social and loving towards their classmates, they want to engage in social interaction with them, their main focus is always going to be on an adult. So if that other peer is ever perceived as competition, then there also might be some inappropriate behaviors that occur between the child with SMS and a peer. There's a lot of reports of pinching and aggression towards peers simply because of that competition for attention. Small class sizes are also important just to make sure that the one-on-one attention is there, that the reinforcers and motivators are readily available and consistent throughout the day. And it also allows for the consistent use of those visual reminders and the cueing that we've kind of talked about previously today. Okay, let's talk a little bit more about reinforcers and motivators. Typically, children with SMS are able to control their behavior when they are motivated. So it's really important to get a really nice understanding of what motivates that child. Having reinforcers for activities out and ready is highly effective in helping a child get through a non-preferred activity. Typically, you can get them through an activity without a major meltdown if they're appropriately motivated. Sometimes just alternating activities is enough for them. So if they can just do 2 of these math problems, then they can have some Play-Doh time. And then we're going to go back to math. We're going to do 2 more problems, and then they can get some iPad time, or 2 minutes of iPad time. Sometimes just knowing that I just have to do this little chunk of work, and then I'm going to get some sort of a reinforcer or motivator can get them through those really non-preferred activities. Sometimes it's important to interview the family to get those motivators as well. Believe me, these families have been searching and very, very well aware of what motivates their children. So most of the time they have a lot of really good ideas for what it is that you can use within the classroom to keep that keep the child motivated to get through some of these tasks. And then another thing to point out is sometimes there is a little bit of a control aspect with schoolwork. So if the child feels that they have some choice in what it is that they're doing, sometimes that can get them to complete the activity more than any sort of a motivator. Sometimes as far as like a tangible object like goldfish or stickers, sometimes just knowing that they had a choice and they had some control over what it is that they're doing is enough to get them to complete it. So offering them two sheets or 2 activities, both things that you as a teacher are okay with them doing, but allowing them to at least choose between the 2 is sometimes all you need to do. Okay, let's talk about meltdowns. Sometimes meltdowns are just going to be inevitable. There's going to be situations that trigger the behavior that honestly you have no idea how the behavior happened, what happened, but you will have to intervene as the teacher and help this child get through that meltdown. So typically the first step is to work closely with the child's parents and family to find out that list of things that can set the child off. A lot of times children with SMS just have very specific things that will just set them off, and it's without talking to people, it's going to be very hard to figure that out sometimes. Very typically difficult times include transitions from one activity to another, especially if the child was enjoying the activity that you are trying to transition away from. Any sort of unexpected change in the school day or routine, such as a substitute teacher, an assembly that the child didn't already know about. Typically if they already know about it and you've prepared them a day or 2 in advance, typically they're totally fine with it. If they come into school and all of a sudden their schedule is jumbled up and not what they expected, then you might see some anxiety and even some behavior. Any sort of emotional upset or excitement in the teacher or classmates. So this is something that's really hard to control sometimes, but just be aware as a teacher that if you are upset, if your tone is different, even if you're having a bad day, it is more than likely, it's highly likely that the child with SMS is also going to have a bad day on that particular day. They sense emotion. It's like a sixth sense with them They can tell if somebody's upset, and they feel it too. And then they have those extreme behaviors, a lot of times just due to what it is that they feel that they're reading. The same thing with excitement. Some other kids in the classroom, if they're extremely excited and extremely happy, sometimes those extreme emotions can set the child with SMS off as well. So kind of back to the non-emotional classroom as much as possible. It's okay to be excited and happy, just those extreme behaviors or the extreme emotions are what can cause the extreme behaviors. When an outburst does occur, sometimes it's helpful just to pull the student aside and talk to them in that quiet, neutral, non-emotional voice. Sometimes you can get them out of a funk by telling them their favorite story, singing their favorite song, telling them a joke, just being happy with them, but not extreme, if that makes sense. When a tantrum is in full swing, it's a little bit of a different scenario. It's best to just let it run its course. At this point, sometimes adding adult attention even feeds that behavior and makes it worse. So the best thing to do is just remove the child from the classroom so that he or she can calm themselves down. If kept in the classroom, even if you try to put them in a timeout corner or something that's quiet and away from others, the child's still going to get some sort of attention more than likely. They're going to hear a child talking about them or a teacher or something, and they're going to more than likely prolong that behavior because of that attention that they're getting. So the best thing to do is if you can find a quiet environment for them to be able to go and calm themselves down with very little adult intervention, that's typically going to help the behavior to be eliminated faster. A couple other effective behavioral strategies worth mentioning are discrimination training and functional communication training. So discrimination training would be very beneficial for teachers to work with students with SMS to show them when an adult is available to attend to them and when they are unavailable. So discriminating between times when it's okay to approach an adult for a conversation or to ask for help and when it's not okay. So this is something that can actually cause a lot of behaviors to happen when a child with SMS attempts to interact with an adult and they're not readily available to them. They will almost immediately drop to the floor and begin having a meltdown. So training them on visual cues. What does it look like when an adult is ready to talk to you? What does it look like when it's okay to approach an adult? Those types of specific trainings and demonstrations will be highly beneficial for a smoothly run classroom. And another instance when discrimination training could be really beneficial for students with SMS is stranger danger. So again, they are seeking adult attention. It doesn't really matter if those adults are people they know or not. If somebody's going to talk to them and give them attention, they're going to want to have a conversation with them and ask them 1,000 questions. So it's really important for safety for them to understand who is a stranger and who is not. So discrimination training would teach them, how do you know if the person is okay to approach, and how do you know if you should not talk to them? So we don't really have a lot of time to get into the specifics of this, but it's certainly something worth researching as part of ABA therapy, if it's something you'd like to utilize in your classroom. And then functional communication training is something that you can work with a speech-language pathologist on your campus to incorporate some functional communication as a replacement behavior as part of a behavior intervention plan. So a lot of times communicating is something that, or communication of some sort is missing in that meltdown process for the child. So instead of voicing their concern or asking for more help because they're frustrated or saying, I really want your attention right now, instead they're just going straight to meltdown, to some sort of a disruptive behavior or stereotypical behavior. So this is just teaching them to basically use their words or communicate effectively. Again, we don't have a lot of time to talk about this particular strategy today, but certainly something that's worth further investigation with your speech-language pathologist. Okay, being proactive is also very important for dealing with children with SMS. Typically, your child or your individual with SMS is a very happy and joyful person. If you, as an adult, notice some negative emotions, it's really going to be important to intervene because those negative emotions will quickly turn into negative behaviors. If they are not happy, then they're potentially on the verge of a meltdown for the most part. So the ability to read the student is very important, and when you talk to families, you'll see or you'll hear them say, we can see it on their face. There's quite a few tells in an individual with SMS before they have a full meltdown. First, start with interviewing the family and seeing for that individual child, is there anything in particular that they can look for? Some examples are, the scowled face and the furrowed brow, just a whiny tone in their voice, more so than normal, that you can just kind of pick up on that. Any sort of extra skin picking or scratching or itching, sometimes they don't engage in this behavior unless they're kind of in an off day. Sometimes they appear to be overly needy. And my favorite is the cyclical reasoning game. So some people refer to it as yes-no, but we also call it the milk juice game. Do you want milk or do you want juice? They might choose milk. You give them milk, then they have a meltdown and they say they want juice. You give them juice and they don't want that either. And both the milk and the juice go flying. There's a lot of days like this where they don't know what they want and they're just off. So if you know that this is happening, you can intervene before they get into full meltdown. So this is really important to cue into these tells. Sometimes they just need some extra time in the sensory room. Let them go, especially if they're doing that skin picking and scratching and itching. Sometimes that's a tell that they're kind of having a sensory day. They need some more sensory input. Sometimes I've noticed with the yes-no game, with that cyclical reasoning, a lot of times they're just tired. So if you can get them to lay down and take a nap, typically it is going to have to be with another adult. They usually will not lay down by themselves and take a nap unless they're just to the point where they're overly tired and they pass out. So whatever it is that you can do to get them to sleep, sometimes that really will help reset them. Sometimes it's just letting them spend some extra time with an adult that they really like. If their PE teacher is their favorite person, maybe they can go spend some extra time helping out the PE teacher that morning, just to kind of put them in a better state of mind and a better mood, and maybe that'll be enough to just get them through the day. Okay, let's practice with a couple scenarios. So Natalie jumps out of her seat and shouts out the answer to a question. How do you redirect her? Do you get down to her level, look her in the eye, and remind her of the rules? Do not make eye contact. Gently guide her back to her seat and continue with the lesson. Acknowledge her answer, praise her, and continue on with the lesson. Which do you choose? The correct answer is do not make eye contact. Gently guide her back to her seat and continue with the lesson. Now, getting down to her level, looking her in the eye, and reminding her of the rules that is a good teaching strategy for some kids, but probably not the best for a child with SMS. This is feeding into that desire for adult attention, and it's going to possibly increase that behavior. So if you give her that attention because of that behavior, she knows that she's going to get more attention next time she does it. So you're really just going to see more of that behavior happening because she knows she's going to get that attention. Also, acknowledging her answer, praising her, and continuing on with the lesson is still giving her that adult input that she's seeking. So therefore, you are really reinforcing that negative behavior. Okay, scenario number 2. Billy is in the midst of a full meltdown. He is screaming, pinching adults, throwing objects, and tearing down bulletin boards. What is the best intervention? 1, try to find out what's wrong by questioning him using calm, direct language. 2, remind him he will lose his motivator, his sticker, or he'll have to clip down, etc., if this behavior continues. Attempt to engage him by singing his favorite song or tickling him, or remove him from the classroom and allow the meltdown to occur with little adult attention. The correct answer is remove him from the classroom and allow the meltdown to occur with little adult attention. So again, there's some good strategies in here, but probably not the best for those with Smith-Magenis syndrome. So trying to find out what's wrong by questioning him using calm and direct language might be okay if he's not in the midst of a full meltdown. If that was happening before the full meltdown, that's probably a good strategy. Maybe if he's just having a few off behaviors. The second, reminding him he will lose his motivator, like a sticker or clip down if this behavior continues, might be okay for a typical child, but that's typically not the best strategy for children with special needs in general. And attempt to engage him by singing his favorite song or tickling him. Again, maybe okay if he wasn't in the midst of that full meltdown, but at this point, if he's already there, giving him any additional adult attention is probably just going to prolong that meltdown. Though we've talked about quite a few problematic behaviors that occur within individuals with SMS, I felt that it would be beneficial to leave this training with a reminder that there's many positive attributes to SMS as well. These children and adults are engaging and endearing. They appreciate attention. They're so excitable. They're responsive to structure and routine. They're easily motivated by a variety of different reinforcers. They're eager to please. They really want to please everyone, and they want everybody to be happy. They're communicative. They have very well developed sense of humors. They're hilarious, and they really do have identifiable causes of tantrums and aggression. So though we really did focus on some of the more negative attributes of SMS, they really are the sweetest, neatest individuals you'll ever meet. Okay, and the last page is my list of references. So I just wanted to thank you all for participating in this webinar and for conducting the pre and the post test for my dissertation. I truly appreciate your efforts and your participation. This will hopefully be able to be used to improve the education of students with Smith-Magenis syndrome and hopefully help teachers of these students feel a little bit more prepared and effective with them. So I hope you all have a wonderful day, and I appreciate your participation.